I will now introduce Angie Martinez. Angie serves as the Regional Director for the Economic Development Administration in the Denver Regional Office. Angie.
Hi, good afternoon, everyone. As Tracy said, my name is Angie Martinez. I am the Economic Development Administration's Regional Director for 10 states here in the Midwest, Mountain West region. EDA is the only federal agency focused solely on economic development, and our work is focused on supporting communities and regions in creating jobs, attracting private investment, and improving the quality of life for their residents. The last 2 years, EDA has been tasked by Congress through funding from the CARES Act and the American Rescue Plan Act to support economic recovery from the pandemic all across the country. We've deployed about $4.5 billion just over the last 2 years, and we're so excited about the impact that these dollars will have on communities and regions. But unfortunately, we know that a barrier to our recovery exists. The lack of accessible and affordable childcare is holding back the economic recovery. Every time I visit with local leaders, I hear about the challenges that they face with finding the workers that their local businesses and their industry needs. And access to childcare is a major contributor to that challenge. You can attract employers or expand job opportunities if those potential workers cannot access childcare. And we also know that women in particular have had to bear the brunt of the negative economic impacts, cutting back hours or foregoing employment altogether due to the lack of affordable and reliable childcare. And we also know at a time that we need it the most, that childcare workers are leaving the industry in droves. They're actually finding higher wages at fast food restaurants than at the centers that care for our kids and give them a head start for their futures. Although we already knew that access to childcare opportunities was a serious issue before the pandemic certainly shone a bright light on the challenges the childcare industry faces, as well as the challenges of working parents. And this can be even more pronounced in rural and frontier communities where childcare opportunities are harder to find. As family budgets across the US have tightened and local communities have changed, a new and different perspective on the importance of quality, affordable childcare has emerged. The perspective views early education and care as drivers of a healthy population and a community's economic growth. Data shows that nationally, the cost of lost earnings, productivity, and revenue from a lack of good childcare options is an estimated $57 billion annually. And that's just too high of a price to pay for families and for our economic recovery. In many ways, childcare is the workforce behind the workforce. Adequate access to quality childcare has impacts beyond the economic activity or revenue generated by the home-based childcare providers or centers themselves or those employed within the childcare industry. The impacts include increased opportunity for many to participate in and bring their skill sets to the workforce, especially women. Employer productivity as a result of parents who have access to childcare reliably showing up for and being engaged at work, and healthy, balanced development of children who have access to quality childcare. And this last point in particular touches on the 2-generational role that childcare plays when it comes to our families and our young children. Childcare is a work support for parents, but it also enables children to be in a setting that promotes their healthy development and their school readiness. So in this way, childcare not only has a direct impact on the economy today, but it impacts the economy of tomorrow. Accessible and affordable childcare is a vital component of vibrant communities and economies, whether they're urban, rural, or frontier regions. Working parents, employers, and even civic organizations rely on access to affordable, high-quality childcare to keep their local economy thriving. So I'm pleased today that our various agencies have come together. They've worked over the last several months to offer today's discussion to you, to explore the challenges, but also the opportunities and the possible solutions that many of you are facing. My colleagues at EDA have been working with Julie Brew, and we're just the other federal partners, and just really grateful for their leadership. So with that, I'd love to thank you for the opportunity to be here today and turn it over to Nikki Hatch, who's the Regional Administrator for Children and Families. Nikki.
Angie, thank you so much. What a joy to be with you. And I'm so grateful for your ongoing partnership. As Angie said, I'm Nikki Hatch. I'm a regional administrator with the Administration for Children and Families. I'm headquartered in Denver and serving Region 8, which is primarily geographically rural and in particular frontier. And as Angie laid out, we know there are additional challenges, barriers, complications, just circumstances in rural communities and frontier communities that kind of make everything a little harder, candidly, especially the stuff that we federally fund and support. We do our best thinking often in Washington, D.C., think of solutions that make sense in other communities and just sort of, send it out to the country. And then sometimes are surprised when things don't scale in the same way, they don't make sense in the same way. Even sometimes just kind of cultural misfits. What I'm so excited about in our time together today is not so much our focus on the additional kind of challenges and complications that rural and frontier communities experience, but rather on the solution set, the opportunities, the sort of grow your own strategies, the working with partners that make sense in a local community. There is so much brilliance, so much innovation and collaboration that happens, and I think maybe is uniquely possible in rural and frontier parts of the country. And I'm thrilled that we get to highlight that for all of you today. Let me pass it to my colleague, Julie Grow, who is on behalf of ACF, the heavy lifter and the chief planner on this event today. Julie, thank you so much for what you've done in partnership with others to bring us together today.
No problem. Thank you, Nikki. Well, good afternoon, everyone. I'm Julie Grow with the Administration for Children and Families, and I'm based in the Denver, Colorado office. I'm really excited for you to hear the stories of each of our panelists as they work to increase childcare availability in their communities. As Nikki had mentioned just a moment ago, today's conversation will focus on rural and frontier communities in the mountain and upper plain states. Often leaders in small communities find themselves wearing many hats as they work to bring about change. I'd like to introduce Vaughn Zanko, someone who does indeed wear many hats. He's the executive director of the Southeast Montana Area Revitalization Team and chairman of the Eastern Montana Economic Development Association. And I think he even hosts his own radio show. Welcome, Vaughn.
Thank you so much, Julie. I appreciate that.
No problem. Hey, Vaughn, if you could you share with us a little bit about your journey to bring childcare to Baker, Montana? And perhaps you could start by orienting us to the size of Baker and where it sits in the state.
Yeah, I think so. And I think a lot of my story here is going to be a journey that a lot of rural and frontier communities have. But here in Southeast Montana, we're not the mountain part of Montana. We're the oil fields part of Montana. And we are the very definition of a childcare desert. There's 4 counties in the entire state of Montana that have 0 licensed childcare. 3 of them are right here in Southeast Montana, Fallon County, where we are, and Carter and Webo counties, which are adjacent to us. And for those that don't know the size of Montana, imagine something about the size of the state of New Jersey with 0 licensed childcare available to anyone. Obviously not the same population, but the same general size. And that's kind of what we were going up against when we started our project. And we are full on, we're an economic development agency. So, childcare wasn't really something that we were focused on at the time, but we were doing strategy sessions and trying to identify the major economic problems that face our area and just rural communities in general. And really, we started to recognize that a lot of these buttons, as far as workforce development, recruitment, retaining workers, all of that, getting kids to move, kids leaving the area and not coming back, and just the economy in general. We recognize that a lot of those buttons could be solved with just some adequate, affordable childcare. So we really dove in and started to try to tackle this project. And I think, like most things, it started off with some research, but we started off with the economics of this, and we recognized some big stats. That here in Fallon County, 45% of females over the age of 16 are not active in the workforce. And 15% of males are not active in the workforce. Those were big numbers. And then we were looking at local businesses that had to shut down like over the county fair when they should be making money because they didn't have the employees. So we recognized there were a lot of people out there that weren't working, and we recognized that with the childcare situation, as far as unlicensed providers go, we had, it covers about 20%, but we have, that's a big number that's still not there. And here in Fallon County, 40%, we are 40% above the national average of what people are paying for childcare. So that means, you know, the people that be working at your grocery stores or your gas stations, your service, they were the ones having the hardest time finding staff. These essential businesses, which really became highlighted during the pandemic, we recognized those people were the ones that weren't working. They were the ones that are staying at home. You know, 16.5% of a family's income comes or goes to childcare in Fallon County. It's supposed to be 10%. The average yearly cost of childcare in Fallon County is $9,600 a year. 4-year college tuition in Montana is $7,000 a year. We're paying more for our childcare in Fallon County than you would to send your kid to college for a year. So that's why we went at this in a big way. We started doing research. We recognized that there were 223 kids in the county. And again, we're a small county, about 3,000 in the entire county. When you add in the Webo and Ekalaka, we get, you know, up around maybe 5,000 in this whole area. But we recognized there were 223 kids just in Fallon County that were 0 to 5 and needed that childcare. We did a full-on feasibility study. We brought in a gentleman from Skokie, Illinois, Robert Siegel, with a group called Leadership Reigns, who came out here for a week and went around to everybody, talked to everybody. And we recognized that the need for childcare, the actual feasibility, if we're going to increase the number of childcare slots, it wasn't out of the question to build a facility with 96 slots for kids. And so that's where we went at it. We said, all right, instead of trying to piecemeal this out, like, you know, maybe we can put some people in a church, maybe we can put some kids in a school. What if we built this massive facility for 96 kids? Because when you look at, you know, I mean, the things we know about childcare, it's a tough business to sustain. The economics of it are hard. But you look at every other business in the world, and consolidation makes it more profitable. So we thought, instead of having, you know, 10 small childcare facilities dotted all around the county, what if we had one centralized location? It helps ease with staffing problems, helps ease with the expenses that would normally come with running a childcare facility. So that's where we went with this. Like, we want to build something big. We want it to be economically sustainable. So we also looked at all of the other major like issues around Fallon County and try to tackle those too. In the design of the building, we added a big community center. We added a large open air courtyard for holding events. And if you've ever been to Eastern Montana, you know that the ability to hold a barbecue and not have the wind come at you at 60 miles an hour during the summer is a huge benefit. We added a designated medical facility for kids and for parents and seniors as well. Because right now, if you're a kid with autism, your parents have to drive you 3 hours to see your therapist. If you're a senior who doesn't know how to do who doesn't have internet access, there's no location for you to do telemedicine. If you're a person who just needs something simple like a urologist, you have to drive 3 hours. Now we can, with this facility, the way we designed it, we can get all of these medical professions here, make it more convenient for everybody, whether you have kids or not. So we really wanted a facility that helps everybody. And then that began the planning portion of this. How are we going to fund this? What are we going to do? Is this actually feasible? We got this big, beautiful building. We got this big idea. We think we got a good business plan for this. And so we started small. We're like, let's just promote that this is a need in our county, and came at it in a purely economic direction. I repeatedly had monthly meetings with the Fallon County commissioners and sort of explained to them, those exact numbers that look, we need more workers. I think during the pandemic, our unemployment in Fallon County ballooned to 1.2%. So I explained the money that would come in if we built this facility, if we can find funding for this facility, we're talking 26 jobs, $1 million in extra income coming to this county. And if we take those 45% of women and 15% of men that aren't working, and I get 10 of them back into the workforce, that's $312,000 in extra income at $15 an hour that would be coming back into the county, in addition to businesses being able to stay open better. And all the other things, recruiting extra businesses and retaining existing businesses. And eventually I kept harping on them enough that we reached the point where we got a nice little grant from 0 to 5 Montana to kind of fund our efforts here, which is a great organization in Montana, and every state needs organizations like them to help out with small rural projects like ours. So we just started holding events, like we're going to do little events for kids, and something that parents can drop the kids off of, and then we can take then mom and dad can have some time by themselves. It got enough attention that the commissioners themselves brought up to us, what if we bonded this out? What if the county issued a bond to build this facility? And the timing was good because we pointed out there was $112 million in ARPA funding for childcare in Montana that I wasn't able to get any of because we don't have a licensed facility in Fallon County. So the commissioners decided to, first off, they gifted us 3 plots of land to build the facility on, right by the lake. I mean, prime real estate, right by the lake, right by a splash park we have in town. And then we continued on. They wanted to know the feasibility of this bonding issue. We found kind of a loophole in the Montana code that says if we get 20% of registered voters to sign a petition, they can order the commissioners to issue a bond, for a general obligation bond for construction like this. I offered to do that to give the commissioners a little political coverage so that so the people don't look and say like, oh man, they're raising our taxes. So we've got the petition signed. The commissioners issued the bond, and now it goes to voters in November to decide if Fallon County wants this $7.5 million childcare facility / community center. And it's blown some minds around the state for sure.
Vaughn, can I ask a question about the bond financing? Bonds, is this something that Fallon County engages in frequently?
What was bizarre about this, Julie, is that Fallon County had not issued a bond since the 1970s. So literally none of us knew what we were doing when we started on this process. We retained an attorney, Dorsey and Whitney in Missoula, Montana, that does this sort of thing. They've kind of held our hand along the way. But yeah, this was new for all of us. Fallon County we're not a county that issues a lot of bonds, and we're lucky that we have a good credit rating, because that, the 20% petition, you can order the commissioners to issue a bond, but if you don't have the credit, you don't have the finances, obviously you can't do that. So it's not a plan that maybe would work for every community, but it worked for ours, and now we've got this on the ballot to decide.
That's amazing. What happens if in November the ballot passes or the bond passes? What happens then?
Well, the neat thing is we've gone into this with about 5 years worth of work. So, we have the preliminary architectural review done. We've got we've been working. We have kind of an idea of staffing. We found, our initial campaign, when we didn't have any idea where we were going to get $7.5 million for this, was just, hey, let's get attention. Let's let people know that this exists. We discovered there are 7 people in Fallon County that have early childhood education degrees that are not currently working in childcare. So if this bond does pass, we immediately are going to be able to jump straight into let's get boots on the ground. Let's start construction on this. There's some staffing to work out. We also have been, in addition to working with the commissioners, we've been working with the city. We've been doing a lot of behind the scenes stuff with existing childcare providers, because we want to make sure they're not left out on this. We want parents to have that choice. So we've been working with them. We've been working with local businesses as far as forming a cooperative, and have just I just had a meeting with the local school who is the school district is jumping in with both feet on this to try to support this. They recognize the benefits to the kids, so we're getting a ton of support from them, from the hospital, from some of the other larger corporations, some of the oil field and natural gas companies really have jumped in on this. And then a lot of smaller businesses are like, yeah, we don't have the money to join a co-op, but boy, you guys got to do this. And so we're working on figuring out ways that this can be something that they can be a part of too. Up to and including our local port authority is actually offering kind of as the North Dakota model, or even I think Michigan, Kentucky running that third. The port authority will pay 1/3 of your childcare costs if you're a business that offers childcare to your employees. And then, hoping again to get more people, more businesses involved in what we're doing. So our next task, if this passes, is going to be just that. We need to get it staffed, which isn't going to be apparently as hard as we thought. We talked to the local senior center. We've got a lot of adoptive grandparents that want to come out there and sit with those kids. We've got 2 colleges not nearby, but within a couple hours that both have early childhood education programs that are interested. We talked to Eastern Montana Head Start that's very interested in moving to Baker too if this facility gets built. So boy, November, there's a lot going on before November 8th, but the day after November 8th, there's gonna be a lot more going on.
That's amazing, Vaughn. One of the questions somebody asked is earlier you had mentioned 0 to 5 and that they've been instrumental in the way that you're going about thinking about this. You mentioned that they were great partners, and somebody wants to know, what is 0 to 5 and how are they great partners, and what should they be looking for in their communities?
0 to 5, they're a Montana childhood advocacy group. What they did was they offered a grant for community childcare initiatives and innovations, like a childcare innovations pilot project. We were lucky enough to become a part of that. Not even with the big facility. I mean, our idea was to do something smaller as a bridge to the bigger facility. We got in the program, we got $6,000, which was enough to start doing some of these events. And a lot with childcare is just getting people to recognize the need. I mean, if you don't have kids, and even parents with kids are so focused on their kids that they're not thinking about the need. So a lot of that $6,000 just went to awareness. And then that became donations, and then that became volunteers, and then that became the commissioners themselves bringing up the idea of doing a bond to get this facility built. Hey, Tracy, there you go. Tracy McIntyre.
There you go.
And the Montana Co-op Development Center as well. Was
Yep,
involved
and
in it
perfect.
too.
I see
There's
Caitlin on here as well. Thank you. A little plug for them.
Good to see you guys.
Perfect. Well, thank you to you, Vaughn, for sharing your story with us today. I'm so excited. I've got my fingers crossed that in the next few weeks, the bond will pass. And so many well wishes to you, and energy drinks and vitamin C as you get to work on this, right? I'm super excited. So
yeah, we're excited. We're very positive about where this is going. So we're thankful, and I think it could be a huge thing for Eastern Montana.
Perfect. Thank you, Vaughn. All right, now I'm going to bring on Lori Sapu. She's the Rural Development Director at the North Dakota Association of Rural Electric Cooperatives, which we just heard Vaughn talk a little bit about cooperatives. Hi, Lori. Maybe you could share a little bit about childcare cooperatives in North Dakota.
Well, sure, I would love to. Good afternoon, everybody, and thank you for that introduction, Julie. I operate a cooperative development center in North Dakota where we help rural people build cooperative and mutually owned businesses to bring about the services they'd like to have in rural areas. After many years in my line of work, I've come to appreciate the differences between rural and frontier. So I really like to hear that definition as we started out. I first heard that term frontier from the Center of Rural Health, and they used it to define areas with 6 or less people per square mile. And 2/3 of North Dakota's landmass has less than 6 people per square mile. So this means we have a smaller customer base to use the services, and we need to be really creative as we develop our businesses. We need more incentives and community participation to help them cash flow. And so just relating this to childcare, one of the first things that we consider when we're helping a group determine how to organize is where they expect the money to come from. Is it memberships, donations, grants, or tax bases? And so it is pretty common in our state to have what is known as a community-owned business. And a community-owned business typically is able to use those tax revenues that have been set aside for economic development. And these taxes are approved by voters during an election. And the community then owns the business, and they can also accept donations. So in most cases, the community will own the building, either the city itself or a local economic development entity, and they will lease it to an operator at a very low rate, sometimes $1 per year, that they don't have that additional hassle of operating the childcare. So this model spreads that subsidy of operating a childcare among all taxpayers. And one of the nice things about this model is that the building is then owned by the community. So if you have an operator that moves on, the community will still have that building and they'll be able to use it to recruit another operator. So another model that we've had success with in North Dakota is the employer-assisted childcare cooperative model, where employers from a community decide they would like to work together to bring about more childcare capacity because they have labor shortages. And usually they know there are people in the region that would like to work, but they can't because there's no one to care for their children if they were to seek a job. We actually heard stories of couples in North Dakota that were communicating among each other, just planning who gets to have the next child because there was a care space open. So if you can imagine the stress behind that. So for childcare cooperatives, this is the one in Hazen, North Dakota. We were contacted by an employee of one of the employers, and she stepped up as the local leader for this project. And in this case, she made sure that all the larger employers from the town had an opportunity to be a part of this effort just by personally contacting them. And this was a town of 2,200 people, so it was fairly easy to identify those employers. That's actually a really large town for North Dakota. And we ended up with 8 employers at the table that were representing energy cooperatives, the public school, a local bank, a nursing home, and the hospital. And then we brought in experience. We brought in the Cooperative Development Center from California, who had already formed several childcare cooperatives. And we held a Zoom call where the employers could learn from California's experience. And from there, we began identifying how large the facility should be and started looking for available buildings. We developed a survey that each employer used to estimate the number of children their employees had and that were in need of care. And we initially thought we would plan for about 30 children, but the surveys indicated we needed to plan for more than double that. We brought in the childcare licensor for that county, and then we began to look at buildings. And she joined us on that search. And this was extremely helpful. She was quickly able to help us determine how many children could be cared for in each building and the modifications that would need to be made. And during this search period, it just so happened that a church was closing its doors and had heard about the childcare group. And they reached out and offered to sell their building to the childcare at a very charitable rate. So once we knew the cost of the building and its capacity, we were able to start putting a pen to paper to see what our startup costs would be, as well as begin predicting those operating costs to see whether this scenario could provide affordable care and if it would cash flow. We relied on tools that were provided through Child Care Aware. They have a startup budget and annual operating expense template that allowed us to just plug in our numbers and play with them. And I believe Child Care Aware is a nationwide organization. And as the employers became more comfortable with their costs and the need for more childcare capacity and what their participation was going to be, they moved forward to formalize their business structure. And they chose to incorporate as a 501c3 nonprofit with bylaws similar to a cooperative. The 501c3 structure allows for the employers to donate to the childcare and take a tax write-off for the donation if they need one. And the cooperative structure provides for that governance. And we do have on our website, their articles of incorporation and bylaws, and I think that will be part of the resources that are shared later. And then they bought the church for $140,000, and the building has capacity for 77 children. And there was one banker on the board that she was the president of the bank, and she had no fear of debt at all. And she set the tone for this group. She just said, let's go for it. Let's take out a loan.
That's amazing.
Yeah. And you need that risk taker. She was our risk taker that was willing to charge right in. And if a banker is willing to incur the debt, everybody else is willing to follow. So that was awesome.
So true. And we're going to hear from them in a few minutes. Take note, Mark.
Then the employers each contributed what they could. So the energy cooperatives and bank were able to donate cash for startup operating. And some of them spread their contributions over 3 years to help that childcare cash flow at the start. And then the school, hospital, and nursing home were a little bit more limited in what they could contribute, but they were able to donate staff time. So for instance, one of them volunteered their human resources person's expertise, or there was cooking and serving meals at the daycare, and there was labor and materials for renovation. We then held community meetings to educate people on the emerging project. We wanted them to know that a new childcare option was coming to town, but we also wanted to alleviate any concerns from those current in-home childcare providers. We did not want to replace them. There was plenty of room for the new center and them. So we were, just making sure we didn't get back to square one by opening up a new center. And then we also shared our anticipated timelines. And then to move things forward more quickly, we formed parent committees. So we had one committee focused on fundraising and financing, and they worked on the budget and cash flow documents, and they wrote grant applications and organized community-wide rummage sales where people donated items to be sold on behalf of the childcare. And many of the donated items were supplies that could be used in the childcare. And Childcare Aware publishes this nifty manual that provides information on staff requirements and square footage requirements. So we use that manual to estimate our staffing needs and costs and plug that into our estimated annual operating budget. And once we got to the point where we were comfortable that we could afford the loan on the building and pay for the operations, we made an offer on the church. And the bank involved in the project provided the loan, and we worked with the Bank of North Dakota to secure what we call an interest buy down. And the Bank of North Dakota is a state-owned bank that will buy the interest rate down by 4 percentage points. So the lead bank still receives its full interest rate payment, but like say the interest rate is 5%, the Bank of North Dakota then pays 4% of that interest, and the childcare then would only pay 1% on that loan. So it essentially acts as a grant for that emerging business. Then we had a building committee that focused on remodel. Some of the contractors were hired, but a lot of the labor was provided by the employers, their employees, and volunteers. Then we had a membership committee, and the membership committee had the duty of keeping the public informed of their progress and developing a method for enrolling new families. And for a childcare cooperative, a person becomes a member by paying a membership fee for each child they enroll. So in this case, it was $25. And they remain members for the duration of their time. The child receives the care through the cooperative. So the membership fee is not reimbursed at the end of their tenure. The cooperative planned to operate below capacity at the start, recognizing that some parents would need to first see how well the center operates before they would trust taking their child there. And so to cover that revenue shortfall, some of the employers agreed to pay for the vacant spots for the first couple years of operating. And to compensate them for this offering, their employees would also have first dibs on those spots should the need arise among their staff. We were lucky this facility was full right away, and they did not need to depend on the employer's assistance for this. And then there was a hiring committee that, with the help of that volunteer HR professional, went through that process of advertising, interviewing, and hiring a director. The director was hired 3 months in advance of opening and finalized the staff and equipment needs. And she also hired the new staff and brought them on 1 month in advance for training and completed the licensing paperwork. And because all of these people already had full-time jobs, this was a sidebar for them. Our Cooperative Development Center provided that technical assistance by helping organize meetings, keep minutes, making connections, research, and basically leading them through that business development process. And there's a nationwide network of cooperative development centers. You can find us by searching for Cooperation Works on the internet. And as you know, things don't always go as planned. We intended this to emerge as employer-assisted cooperative and then migrate to a parent governing board once the doors were open. But to be a member, you would need to have a child enrolled in the childcare, and to be on the board, you needed to be a member. This would help prevent some of that community burnout where the same people end up serving on everything until they just can't do it anymore. But this was a way to bring younger people into that leadership role, exposing them at an earlier age. But what actually happened is that the employers chose to remain on the governing board once the business was launched. But now we do have parent committees that work on issues as they arise. And even with all this planning and employer participation, this childcare has struggled to emerge from the pandemic. We have plenty of demand, but there aren't enough workers to operate at capacity, and they have recently had to let some families go. The most recent living wage published for North Dakota is $21 per hour, and the average childcare worker wage is $11.21 per hour. It's among our lowest paid occupations, making it really hard to attract and retain quality workers in an environment that is competitive for workforce. So just one last comment on cooperatives. They are so flexible. There are 2 other co-op models that I know of that could work for childcare that I'd just like to mention briefly. And full disclosure here, I have not tried these models yet. But California has. So there is a child care home provider cooperative, and these providers are independently licensed and operated businesses. And sometimes these providers can feel professionally isolated, or they may lack the time to do marketing for new clients. And they may lack benefits such as sick leave or vacation. So these issues can be addressed by forming a cooperative. Through a cooperative, each business can remain independent, but decide on key elements that they hold in common, such as certain quality standards or benefits to parents. Home care providers can use a cooperative to jointly market, increase clients, maintain consistent client bases, or be more selective in their clientele. They can provide members and their clients with backup care if they are ill or want to take vacation. They can share meal plans, develop procedures, business paperwork, and client agreements and forms together. They can create their own toy lending library, or they can create joint special programs such as field trips or music days or park days. And they can leverage buying power through joint purchasing of supplies, equipment, food items, and insurance. And there is the child care worker cooperative model. And in this model, the director, teachers, and sometimes aides can join together to cooperatively own a child care center by combining their energy, capital, and skills. And the workers gain steady employment and income, and they participate in decisions that affect their workplace, and they share in the business profits made from their investment in labor. The child care worker cooperative governs the business democratically and makes decisions about pay and authority, as well as all aspects of the business. So this is what I know about developing cooperative and mutually owned child care centers, and I'm looking forward to your questions.
Thank you, Lori. I appreciate you sharing the experience of the cooperative in Hazen. While there's so much to celebrate in Hazen, I also thank you for sharing some of the challenges and the real world struggles that offer us all an opportunity to learn. Thank you. Now I'd like to introduce you to Mark Evans. He's the community bank president at First Interstate Bank in Riverton, Wyoming. Mark, tell us a little bit about the Red Wolf Child Care and Healthcare Center at the Northern Arapahoe Wind River Reservation in central Wyoming.
Thank you. So pre-pandemic, and about 2018 is when we started on this project. We've had a relationship with the Northern Arapaho tribe, and our reservation actually has two tribes on it, the Eastern Shoshone and the Northern Arapaho tribe. So dealing with rural communities, as we've been discussing, and the two main pain points or the issues that we are facing, not only as a community and the reservation, the two primary factors that needed improvement at the time were healthcare and childcare. So we worked with tribal leaders to try to come up with a solution to solve both of these two different issues that were really impacting our community. So working together with the Northern Arapaho tribal leaders, they approached the bank, and we were able to work through some different ideas and issues and come up with a solution that we needed a child care facility located on the Wind River Reservation. And then we also needed to improve some healthcare facilities located in Riverton, Wyoming. Together, we partnered with a CDC out of Montana, MoFi, who really led us in the path to determine the best overall process and financing structure to complete the goal. So Norman Willow, Sr., who is a tribal elder, was quoted, who really put the vision together for this project. Basically, he wanted to build a center that was for the children in the community. And through that, we were able to achieve it by partnering and utilizing a new market tax credit program, thanks to the guidance and expertise from MoFi, a CDC located out of Missoula, Montana. The project.
Hey, Mark, can I jump in for a really quick second? I am not in the banking world. Could you explain a little bit about new market tax credit or MoFi?
Yeah, and I was going there. So
Sorry.
no, it's okay. So the new market tax credit program, MoFi started, and it was created in 2008, and created partnerships between bankers, businesses, and local development organizations throughout the region is when it became impactful on that side of it. So what it essentially does is that in individuals or businesses and community projects that are located in certain census tracts would be eligible for a new market tax credit program or opportunity. Without meaning there's a certain amount of interest that's paid, and then businesses on the backside would buy that credit and get a tax credit in favor of the project being completed. So the project was broken down into, for this project, it was about a little over $7 million project that we were able to couple a tax credit structure along with some debt and some equity brought in by the tribe to make the vision come to completion. So overall, the child care facility, which is a 13,000 square foot building, the estimated cost from the beginning of this in 2018 was $4.1 million. The Riverton Clinic would have been $3 million to improve not only dental, lab work, and other medical service optometry for our tribal members as well, located on the Wind River Reservation, have better access to healthcare needs. So from that point, the new market tax credit structure was put into place. We were able to work through that with a team of not only from MoFi, the CDC located in Missoula, First Interstate Bank, and with the Northern Arapaho tribe's visions of doing what's best for our communities. We were able to couple that structure together and create a 13,000 square foot child care facility located within the bounds of the Wind River Reservation that services, it has space for 300 children aging from 6 weeks old up to 10 years of age. It provides 24-hour, 7 days a week care to assure, and it is charged on a sliding scale to ensure affordability for low-income families. The tribal businesses located, such as the Wind River Casino and 789 gas and convenience stores, right around the child care facility. There's about 500 employees that utilize the facility along with the Riverton population itself. So, and then, but it did take a lot of hard work from funding partners to the project to make it a reality. From community members, we had to get architects, engineers bidding out to make sure we followed along the new market tax credit policies and to ensure that the completion was done. But it is fully operational, and now it houses about 270 children on a 24-hour basis and helps reservation as well as Fremont County's community as a whole provide that 24/7 daycare option that helps families to ensure that they have availability to child care at any time.
Mark, I'm going to just stop for a moment right there and say that there's so many people on this call in awe right now about the 24/7 availability of this. We know that after hours care is so hard to staff. And so this is just amazing.
And it has been amazing, and it's actually helped. The thinking behind that is we have pre-pandemic, we had two 24-hour businesses. Essentially, we had a Walmart, and then we did have a casino that was a tribal-owned business, and they were having hard times staffing those facilities. And actually, the staffing issues to staff the daycare were not as hard or challenging as we thought they'd be. It's amazing the support you get of people willing to help children out, especially in a smaller rural community. So it's been really amazing, and it's really helped the community and the reservation out as a whole. So it's been really amazing.
Mark, can I ask you, it's not often I get to talk to a banker, so I'm just going to ask you questions. Okay. Could you tell me what information do bankers want to know when they come to you and want to have a conversation about starting a child care? What is it that you need to know?
Well, like in these cases, I think
Well, the puppy may be thirsty. I might encourage everyone to put their microphones on mute.
was not me, Julie.
Yeah,
No, I would say that if you're looking for access, I mean, the hard thing is everybody in a community, especially a rural community, in my opinion, wants access to everything. But I think the feasibility piece of it is probably the thing that we really have to. I've never seen a projection that doesn't work, but we need to make sure those projections are feasible in our communities, I think, and really to have a really good vision, mission and vision and values that align well with the community and where you're going with it. So if you establish a good vision of where you're headed, that really assisted us, I think, in this. The tribal leaders were instrumental in putting a vision together of what they wanted, and then we were able to size and scale it off of the feasibility of it. So I think that if you approach it with good intent, and then you scale it down to an economic scale that will work within your community and where the need really is, it became a successful project because of those different ideas. I can't hear.
Can you hear me? Sorry.
Yep.
Another question that I might have is I heard Vaughn mention something about the commissioners gifting them the use of the land, the 3 plots. And Lori talked about banks being able to cover some of the interest. And I think that you talked a little bit about the needs for somebody else to come in with being able to back up the building of that facility. How does having another partner, or how is it that having a cheap facility, and I know we're talking about millions of dollars here, help in bringing a bank on board to finance a project?
I don't necessarily know if it's a cost driven. Like I said, it depends on the need of the community. I mean, the cheaper, we're all into multi-use or using a building in the community or renovating a building that's existing. I think that could save cost. But I think the biggest limiting factor, especially in childcare, is trying to find a partner to limit some of those equity positions. So, and that's where the cash flow and the functionality of a lot of this falls under, is if you do have to have a partner, or the community, the county, any of those rural areas. And again, to be willing to partner with you as far as an equity position to ensure the success of it in the future. Because especially bankers, we love our communities and we do want to watch everything work, but we just need to make sure that it works at the appropriate debt levels when we go into these things. So I think that by its own stance, the success rates more if you have the right partners behind it or the right structures. And there's, like we've been talking, there's lots of different structures, but choosing and determining that structure is valuable, or is the most important piece, in my opinion, to make it a success.
That's great. Thank you, Mark. Thank you for sharing with us the history of bringing together the Red Wolf Child Care Center and Healthcare Center. It's got to have such a huge positive impact on the community, and I'm sure the effects can't be overstated. So I'm so excited to hear about that. Thank you.
To answer that, there's a question in chat on the sliding scale, I believe. The revenue streams, there's different federal assistance for some of the families, or I think it's state assistance, and don't hold me to that completely, but there is assistance. So the revenue of the actual child care center was not impacted on the sliding scale. They do have to provide income verification. I'm sure there's people on this call that are way more advanced in this area than I am, but in our opportunity, because of the income levels, there's different availability for federal assistance. So thank you.
Great, thanks, Mark. All right, well, while we transition to our Q&A portion of the convening, I'd like to share with you a few pictures of the projects you just heard about. On this first slide, you're going to see architectural renderings of the project in Baker, Montana. You'll notice that courtyard to protect against that 60-mile-an-hour wind that Vaughn mentioned. And next, you'll see a few pictures of the Energy Capital Cooperative Child Care Center in North Dakota. And finally, here are a few pictures of the Red Wolf Child Care Center serving the Wind River Reservation in Wyoming. Great. Thanks, Tracy. All right, so now let's bring back Vaughn, Lori, and Mark to join us. Perfect. I'd like to invite anyone who has a question for our panelists to please place them in the chat or to come off mute. While we're waiting for questions to come in from our attendees, I'd like to open it up to each of you panelists if you have any questions about each other's projects.
I just, real quick, Lori, I know that North Dakota has had a pretty good buy-in from the state as far as supporting childcare, more so than certainly Montana has. Has that been helpful? I know there's a lot of different programs that we look at in Montana and we're like, man, if only we could get that here. Has that been helpful with the co-op?
You know, I'm not familiar with all of the programs there are, but we do have incentives, so our subsidies, I guess. So lower income parents then can receive some of their childcare paid for. The problem that we have with that, and maybe that's something that's done nationwide, I don't know, but I guess only 10% of the funds allocated for that program are actually drawn down. And it seems like in a rural area, people don't want to be distinguished as low income necessarily. So there's a detriment to applying for those funds. Then I mentioned the Bank of North Dakota. We are so fortunate to have a state-owned bank to help us bring affordable financing to our projects. Yeah, I don't know I don't feel like we have more than Montana, but I really don't know what Montana has. So we struggle when it comes to the development costs. We look for foundations, we know anonymous donors. It's why we went to employer-assisted childcare so that we could bring the employer money in. It's hard to find the money. Oh, we do have a grant program for infrastructure. They can fund like 3 every 2 years, and it's gone instantly. It's gone. Like if you're not ready July 1st when the biennium starts, you can't get that money. So, and it is all about money, right?
I go to, looks like we have one question. Nikki?
Yeah, I first wanted to thank the panel. This has been really rich conversation, and unlike many other early childhood or childcare focused convenings that I've been part of. So thank you all for sharing your experiences. My question is about your experience with partnerships. Each of you talked about bringing in an array of community partners, some of which I think of as kind of like the logical ones. You've got parents, you've got like sort of the obvious stakeholders and partners, and some are atypical. Mark, I think I heard you say, we just say it's about early childhood and everyone cares about kids. And I'm wondering, and I bet there are other partners or other conversations that were a little trickier to access. So sort of from any of you, kind of what's the wisdom that you have to share with us collectively about how you talked about the value of your projects, particularly if you had skeptical or reluctant partners you were trying to bring into conversation. And before we get answers, Julie, I'll just orient everyone in the group. If you just go down to the screen to that reactions button and click on that, you can raise your hand and then we'll be able to see you and call on you by name. Thanks.
Well, I'll jump in. I think on our end, as far as getting the buy-in, I mean, obviously it helped that we had done a ton of research first, so we kind of knew what direction we were coming from. But also, I mean, when it came to those skeptical people, especially, when you're looking at a bond issue, a lot of that, it's not a huge buy-in. I think the average tax increase in Dallas County would be like $40 a year for this, so it's not a huge buy-in, but it is for some of these rural farmers, ranchers. So it became important to go into this and show the benefits of this that have nothing to do with children. And I think a lot of times, one of the pitfalls of talking about, hey, let's improve childcare, is that we go in all sunshine and lollipops and like, it's kids, guys, let's help out. But I think a lot of times you need to see this return on investment. You need to see the buy-in for everybody, the what's in it for me. And that's really the angle that we came at. I mean, when we were going to some of these bigger companies, we were going to the city, we were going to the county, and we're going to these ranchers. We need to show them what's in this for you, and that's why we added a lot of this extra stuff. But I mean, really, it's been helpful coming in on the purely economic aspects of this, and say like, yeah, the kids are great, but I can talk to you for an hour about the benefits of this that have nothing to do with kids.
Absolutely, Vaughn. I think you also mentioned earlier in your presentation about offering childcare while parents went and had their own night out, right? And then also I heard you talk before about how you did a lot of speaking to people at the county fair, right? So making sure that you're going all of the places to talk to so many different groups of people, and particularly the commissioners, the county commissioners seemed like they were a great partner for you.
They really were, and it's important to have all of those voices in these conversations, because we wanted this. We recognize on our end that childcare benefits everybody, but explaining that to folks isn't always the easiest thing. I don't have kids. What's the point? But we started this project. I've got two-year-old girls. I started this project before they were born. I started this project before I was married. And by the time it's done, they're probably going to be aged out, so it's no benefit to me really. But it's important that everybody recognize that if you want your favorite store to be open on Sundays, we need childcare. If you want your hospital to be staffed, if you want teachers in your school, we need childcare, and that's something that affects everybody. So just getting that information out to people was huge.
I can go ahead.
No, go ahead, Lori. You're good.
Oh, thank you, Mark. I completely agree that data is really powerful when you know what type of a gap that you have in your community for childcare and the impact that that's having on your businesses. And, if I need to have a nurse when I go into the clinic and there isn't one because there's no daycare, well, that's affecting me too, whether or not I have a child. But we've also, over the years, come to understand the human nature of it. And humans, like I said, money's everything, but humans are sometimes the hardest part, like getting everybody on the same page or agreeing that they should be investing or participating in something. And It's actually been defined like only 3% of us in this world are risk takers, those people that are willing to try something without having evidence that it actually works. You know, we need to see it first. And then there's only 14% of us on top of that 3% that are early adopters that will try something without the evidence. But as long as you have a risk taker that says, yeah, I'll try that, they'll follow the risk taker. The rest of us are kind of lag-alongs, like we need to see it before we'll do anything about it. And so in your dynamic, if you can recognize the types of people that you have on board, and sometimes it's good to promote somebody. If you know somebody's a risk taker, try to get them to sit on that steering committee and help that project along.
I was just going to add too on that. Vaughn and Lori did a really good job of explaining that, but I was just going to say, I think that's where a good vision and vision statement or where you're headed helped in this, in our case, because if you can get people on board that it's not a risk, that it's more needed, and it's something that will impact everybody, and it does impact the entire, especially in more rural communities. If your coworker can't come because they don't have access to childcare, then you're overworked. Or so if everybody's on board with those different aspects of it, it does make it a positive, because it is something that it's needed for the kids, and it's also needed for business owners, community members, coworkers. So if the need is there, then it's easier to on that vision. That was all I've noticed through our project.
Thanks, Mark. One of the questions that I received from chat asked about the outreach that you all did to existing providers before you worked on these projects. What was that outreach like? How was it received? And what were some of their fears, or what was the conversation like?
I can go first on this. With our project, we have another Smart Start, a local daycare facility that actually is about the same scale. It does not operate 24 hours a day, but it's about the same size and scale, located within Riverton. So we reached out to the owner, and then she actually joined on as a consultant for the project to help us, because the need, there's such a need that she can only staff to a certain level in her business to supply for the community. So for current business owners to care about their community enough, because the need is there, that you know you can't expand or provide the care you need to for it. I thought that was just really amazing to show our community involvement in it, that we would have somebody join in, help with architectural designs, help with everything to make sure the project or the facility set up and established right. So, and again, I think that's just shows how rural America works, that you can be the competitor trying to compete against somebody's business, but they know the needs so great that they just want to do what's right for the community as a whole. So I thought that was very neat, and it wouldn't have been as good of a success on the building or the facility without having that input.
You know, I'll kind of echo what Mark said. I mean, from the start of our project, I mean, the very first meeting we had, we wanted all of the local providers that were available to come, and you know, we asked the question, we want to tackle childcare. What can we do for you that'll make your lives easier? And they did. They said, you know, we need more slots. I can't take everybody. I can only do so much by myself. So we kind of got to go ahead from them that, you know, and we wanted to make it clear all the way along that, you know, we're not here to compete with you guys with this big project. We're here to, you know, even with 96 kids, it's still only about 40% of the total number of kids in Fallon County that we're going to be able to provide childcare for when you include those unlicensed ones. So we wanted to make it sure. We wanted to make it clear that we're not competing. We're working together on this. And to that end, yeah, I mean, once we started our partnership with 0 to 5 and MCDC, and you know, we started getting more resources. We started sharing those resources with our local providers so that they've known, even as this project has grown, that they hopefully didn't feel threatened. That, you know, like, hey, we're here to support this big facility, but we want to support you too, because we're just about childcare in Fallon County, not just this one building. So we've, on every step of the way, we've asked them questions. What do you think about this? What do you think about this? What direction should we go on this? We've wanted that. They've been involved the entire time.
I can't add a whole lot to that. We did reach out early. We contacted them before the public knew this was emerging. And then we offered I've worked with 8 or 9 different childcare centers, and we've offered things like you can purchase your supplies through this center and get them at a more affordable cost, things to help them operate more efficiently as well.
So there was another question in the chat. How are you balancing childcare affordability with affordable childcare provider wages and childcare business viability? So even with the support of donated land and building a facility, oftentimes the business model will still have razor thin margins, putting pressure, a lot of financial pressure. So maybe Lori, I'll turn it over to you first, because I know you touched on this briefly in your remarks.
It's a problem. It really is. Like I had mentioned, we did have that the cooperative itself has been turning back some children, from care because they don't have enough care providers. We're not paying enough money. We did target CNA wages, the certified nursing assistants, because we felt like it was an equivalent salary base. That hasn't seemed to make a difference. We also factored in a healthcare stipend, and for the full-time employees, not health benefits, but that hasn't helped as much either. So just trying to think of solutions here. We don't have the solutions. It would be helpful to be able to offer health insurance. That would be on my dream list if that could be provided for the childcare workers, because it's typically women that have children that are working in the facilities, and having access to healthcare would be a huge benefit. But it's been tough, and I know our government's trying to address it. They've rolled out some plans for increasing the pay for the next legislative session. So we'll see if that works.
Thank you, Lori. Robin, you had a question?
Yes, hi. I'm sorry, I'm driving, but my name is Robin. I run Child Care Aware of Missouri, and I'm actually on the way to a rural community to have this same conversation. And I want to piggyback on the last question, because what we're hearing across our state in both rural and urban and micropolitan areas all over is the workforce shortage of child care workers, the recruitment, the retention. And, it sounds like everybody's still, we know there's no magic wand to solve all of this, but with these different models that are, standing up or perhaps have been around for a few years, is there any kind of data that backs up any kind of teacher retention on how, like the employer assisted one or the one with the tribal partners? Like, who can speak to any of that? I mean, it's not just the wages alone. It's more or less the retention of those workers for the consistency of the children. So I'll leave it at that and see what folks have to say.
We have the best luck retaining the directors and the teachers because they are better paid. It's the aides that we struggle to keep. That's the lower tier of the employees. And if you don't have the aides, then it affects your capacity. But with those two positions, we are able to pay better, and we do agree that you need consistency.
One area that we've got a lot of excitement about, and you talk about the aides. There's been a lot of excitement to hear. Like I said, I mentioned briefly while I was talking, the local senior population that still wants to stay active has been very excited about, like, boy, if you guys get this built, I want to come out there, maybe spend 4 or 5 hours a day. So I mean, that's it's an area of you've got a kind of an untapped resource of people who may not be in the workforce but want to, but not in a huge way. But that's an area definitely we've been in lots of conversations with them as far as helping keep things staffed out there. Just the senior population that wants to be back in the workforce in some limited way.
And Robin, I will mention that in the resources that you'll be receiving from today's event in a few days, you'll also see a link that provides strategies and resources to address workforce shortages. This is maintained by the Administration for Children and Families, the Early Childhood Division. So that'll be in the resources that come out as well.
So I have a question, if I could jump on. Thank you to all the panelists. I'm sure that many people on the call are feeling really energized and excited from hearing your stories, and would love to do something different, something similar, I mean, in their own communities. So what is one piece of advice that you have for those 3% risk takers or others, hopefully, that would like to do something similar? If you have one piece of advice for them, what would it be?
Well, I've been developing cooperatives since 1998. This was the easiest project I've ever worked on. I think it's because we selected an existing building, which cut down the development time. We're not doing the large $1 million projects that Mark and Vaughn are working on. We went small scale, North Dakota style. But it only took us 6 months from launching that first meeting to opening the doors. So it doesn't have to be that complicated. There's lots of templates out there. There's lots of resource providers out there to help you. Communities have personalities. If you're with a community that really wants this to happen, you can make it happen.
I was just going to say the thing I've noticed is it doesn't take very many active people in a community. If you can get a small group of people to back you and help you get one of these projects off the ground, it's amazing how much a small group of people and a small community can get a big project done. But you just have to have the right people to put a lot of work in and overcome whatever challenges is put in front of you. So that's my piece of advice, I know. But I've just noticed if you get the right people, you can really come through anything and find the right structure that works for the community and come out with a successful project.
On our end, it's I guess the best piece of advice is just start somewhere. Whatever your current resources are, start with those, because that's where we are right now. As we started off, doing simple little events. We had we invited kids out to decorate Christmas ornaments, and here's haunted gingerbread houses. Let's do that. We had a family feud night. Just getting people aware, and that getting people in the community talking about it. Then got businesses talking about it, and then they started recognizing, hey, childcare would be good. Then once businesses started talking about it, then the city started talking about it, and the county started talking about it. But it had to start at that lowest level, and you needed to raise up that awareness, and that's where we started, and then eventually it got up to the county commissioners, and that put us where we are right now. But just doing something to start anything you can to help with childcare, even if it's just taking care of kids for a couple hours while they're decorating ornaments, and mom and dad can go out and do something. Anything is a good start.
On to gingerbread houses, huh? I like it.
I have a question. This is Joanne Henry. I work for DCF in Kansas. I'm the Kansas Early Head Start Program Manager. I worked for Head Start for years, actually, as a teacher, director, all those positions. I have a question, and maybe this was asked. So you did all of this, like in Manhattan, Head Start started in 65 when Head Start started, and it has grown, and now it is unified with the school district and the preschool the school district. It's 0 to 5. It's a really great program. They stay pretty fully enrolled. We've got Kansas State University here, which is a benefit, and for positions and things like that for teachers coming out. I guess my question is, for the families, like, Head Start's low income. So for the families that are low income, how do you figure out what you're charging and keep it full? My other question is, do you stay full? Are you guys staying full that have it going?
Well, in North Dakota, we charge the same across the board, and we have access to a state subsidy that can cover the cost to make it affordable for lower income families.
Okay, yeah, we have, that's part of the childcare subsidy, yeah.
Yeah.
I was just curious because I know like in your rural communities and things like that, it's sometimes hard to get staff on board or to get hired and come work there. So that's, and I know your salaries are different in different areas. I mean, ours isn't the greatest out here, but they've been doing a whole lot in the state of Kansas. The grantees and all of bumping up salaries the best they can with what they have funds wise and things like that. But I was just kind of curious, how you stay full. And your guys now, Vaughn, is it yours? Whose is the one that's a 501c3? Vaughn's yours, right?
The childcare co-op was.
Yeah.
Okay. So you're a 501c3, so you're non-for-profit, right?
Right. Is yours Vaughn as well? I didn't hear your answer.
We're not. We would be
Okay.
regular,
You're not.
regular cooperative, but for profit.
Okay.
Okay. Well, I just probably asked crazy questions, but I was just curious.
Oh, thank you.
Can I piggyback on that just a little bit? I'm curious, in other states, like our state puts a lot of focus on providing those dollars to the families to make the childcare affordable. I'm wondering if any states provide the dollars to the childcare itself rather than the families.
I don't know if this would answer your question. The job what we do is with our child care subsidy, parents get assistance to help pay for childcare. But we have, because I'm the Kansas Early Head Start Program Manager, and what we have is a partnership with 11 grantees. And any grantee can ask if we have the funding, but we have a partnership with 11 grantees, and they apply for so many children to be funded by the state. Then we do grants and we do all of that, and that helps to fund the slots for the kiddos that are there. I don't know if that's answering your question really well.
Thank you. We also see that Angie put into the chat that Louisiana has tax credits for the providers as well as the parents, and the tax credits for businesses as well.
Yeah, I don't think we do that.
Yeah, and I can just say that the ones for the providers, they get more and more of a tax credit based on where they fall on quality level. So it's tied into their quality rating and improvement system. But it is one way for a state that may not put money directly towards early care and education, to kind of do it on the back end through a tax credit. So a state that may be more maybe politically conservative, they were still able to provide support for childcare that way.
Can I ask you all a question? I heard you talk about in your journeys to childcare in your communities, things like bond attorneys, feasibility studies. How do you start that? There's a big jump between, haunted gingerbread houses to finding a bond attorney or finding somebody to complete a feasibility study. How did you find your way towards these resources that help you get to Mark and the money, right?
I think for us, it was finding these other childcare resources that are available. And there's a lot in every state, I think, that are just unknown. So I think, when we got in touch with 0 to 5, and Raise Montana is another group that does a great job. We got in touch with them, and they were able to share their contacts and resources with us. And then we kind of just able to go and look and like, okay, well, they're doing that, they're doing this, they can help us with this, they can help us with this. And it really, just like I said, just getting started in some direction, and then those contacts and those things to sort of start to build.
So it's not. Go ahead, Mark.
I was just gonna say, I think if you start like where you're saying about the gingerbread, I think if you start there, and then you kind of, once you build that list of, kind of come up with the structure of the way you want to move forward, then it leads into all of those different, I call them obstacles, but they really are obstacles. And then you have to get a certain amount of due diligence done as you move through the process, and it kind of works itself out. But that's the way I've always seen these projects done, is that the communities behind it, you come up with that structure, then it's just something you have to work through to achieve the goal at the end. So that's how I see it happening anyway.
And feasibility studies, like that scary word, like if you've ever worked on launching a really large business, you got to hire a consultant, and it can cost thousands of dollars to get that feasibility study done. It might have for Vaughn and Mark, because there's our larger facilities, but on a smaller scale in more rural areas, you're not going to need something like that. You're just going to need to verify like how many kids are in the county that might need care, and how many childcare spots are there currently, and are there waiting lists among the current care providers. And that's what leads to your initial, like, yes, it would be feasible to investigate this further.
You can do a lot with SurveyMonkey. Like, they're just asking questions. We did a survey, 90% of residents in the last month, and this is just this year, 90% of people in Fallon County have missed a day of work because of childcare concerns in the last 30 days. And that was out of, with 274 responses, but that's still, that's a big number.
Who do you get to send or create a contact list for your community? How do you build that? So you can hear about those wait lists, so you can do those surveys to find the needs and to find who to connect to.
It's pretty simple in North Dakota because we're so small. We just kind of know who's in the county or who's in the city. So I can't add much to that. We're just so small, we know.
But in our case, it was, and I do work in radio, so it was nice having those media connections, and between the radio and the newspaper, we had a lot. We knew kind of the movers and shakers, so that was helpful. But if you're not in radio, I would, you can certainly get a hold of them and get a hold of your newspaper, get a hold of your local radio, and find out, like, who would you interview if this story was coming up. A lot of times they'll just know that. They'll know, like, if something comes up, they know who they're going to call to get a quote on that topic. So that, I think that can be very helpful.
That's a great lead. All right, well, thank you everyone for your willingness to share answers and your expertise as we went through this Q&A. I would just want to extend a giant thank you out to each of you. I so appreciate you, your expertise, and your time. Thank you. So before I turn it over to Ben for a wrap up, I would also like to thank the Department of Labor, the Economic Development Agency, USDA Rural Development, and the Federal Reserve Banks of Minneapolis and San Francisco for their partnership in putting today's event together. Now I'm pleased to introduce Ben Horowitz, the Senior Policy Analyst with the Federal Reserve Bank of Minneapolis.
Thanks, Julie. And I'll just echo your thanks to all of our partners and all of our presenters today for taking the time and being so generous to prepare for and present their stories to all of us today. And thank you also to all of you who attended and made this one of the most interesting and distracting chats I've ever seen in a Zoom conference in the last 2.5 years. So like Julie said, I work for the Federal Reserve Bank of Minneapolis in the Community Development and Engagement Division. So my opinions and views today are my own and don't necessarily reflect those of the Board of Governors or the Minneapolis Fed. Our district stretches from Montana all the way over to the upper peninsula of Michigan. So we fold in North and South Dakota and Minnesota and a slice of Northwest Wisconsin in there as well. We have 12% of the nation's land, but 3% of its people. So talking about rural communities is very important in our work, and that distinction between rural and frontier also really comes into play. The Federal Reserve was set up to have that regional sense of input into all of our decision making. And along with Tracy from San Francisco, we also have colleagues at other Federal Reserve banks who have dove into childcare over the past few years, and just want to extend ourselves as a resource along with all of the other planners Julie named. So I heard a lot today about the strength in rural communities that comes from everyone having a role to play in early childhood development and education. We heard about everything from planning haunted gingerbread houses, which is actually happening at my house right now as we speak, all the way on up to helping put together really complicated deals to secure financing. And I also resonate a lot with me when Lori talked about not just the role of institutions, but also the role of people, and recognizing that people have a wide range of strengths to draw on in the planning process. So we can't travel anywhere in our district without hearing about the challenges that childcare is currently facing in today's environment, but we also don't have any shortage of stories like these that demonstrate the capacity of communities to adapt to the resources that are available and the opportunities that are presented to try and do the best they can to start resolving these issues. So please keep an eye out in your inboxes for a list of resources that live on the internet that will connect you to more information about what you've heard about today, as well as other things that are out there that we hope are beneficial. And also think of the organizers of this event as another resource to follow up with as well. With that, I will thank you all one more time for your attention and hope you have a wonderful rest of your day.